Trans-resveratrol is a compound found in the skin of grapes and in red wine. It is quite a compound. It has been found to have antioxidant, anti-inflammatory, neuroprotective properties as well as having effects to improve memory and learning. While these effects are incredibly interesting and subject to other areas of research, it is the antidepressant effect of this compound that has caught the interest of many. Depression is a rising problem around the world. In fact, it is thought 350 million people currently suffer from depression. In the current age, one of the first ways that we respond to severe depression is pharmacologically. Depression works by depressing the serotonergic and noradrenergic brain systems. Depression may occur if the monoamine receptors are insensitive or if amine synthesis, storage, or release is impaired. This theory of depression is known as the monoamine hypothesis. Dopamine has also been theorized to be a factor in depression, as it has a regulatory effect on serotonin and noradrenaline systems. MAO-A is an enzyme that acts to degrade serotonin and noradrenaline in brain system synaptic terminals, thus terminating the effect of monoamine transmitters, and has also been implicated in the treatment of depression. Other areas and systems that have been implicated in depression are those such as free oxygen and nitric oxide, which have an oxidative effect on the nervous system. The current drugs used to treat depression are selective serotonin reuptake inhibitors, tricyclic antidepressants, serotonin and noradrenaline mixed reuptake inhibitors, and noradrenaline reuptake inhibitors. These drugs work mainly by increasing levels of monoamines in the brain, by stimulating release or preventing degradation of monoamines. Trans-resveratrol acts in a similar way to these currently used drugs. Trans-resveratrol has been shown to have a similar drug profile and action to drugs such as imipramine and fluoxetine. A possible advantage of trans-resveratrol is the lack of some side effects such as locomotor stimulation. Trans-resveratrol has been found to increase serotonin in the frontal cortex, the hippocampus, and hypothalamus. This is quite similar areas of action as the tricyclic antidepressant imipramine and the amine oxidase inhibitor moleclobamide, both of which are currently used antidepressants. The brain noradrenergic system involves the limbic system, which is involved in emotion and cognition and is implicated in depression. Trans-resveratrol produces increased cranial-noradrenaline in the frontal cortex and hippocampus. It has a greater action than fluoxetine, nicozetine, and imipramine. Trans-resveratrol has also been found to increase dopamine in the frontal lobe. However, this effect has been thought to be due to the action of the drug on the noradrenergic system as opposed to direct stimulation of the dopamine system. Another way that trans-resveratrol acts is through the action on MAO enzymes. MAO are the enzymes that act to degrade monoamines. MAO-A degrades serotonin and noradrenaline, and this is dose-dependently inhibited by trans-resveratrol. And MAO-B affects many of the trace enzymes and is inhibited only at high concentrations. Dopamine and tyramine are affected by both MAO-A and MAO-B, and this could also lead to the alleviation of depression. It has a mid-range depression of MAO, with dapril being higher but chloroline and iperonazide being lower. Trans-resveratrol has antioxidative actions. This is important in depression since it is theorized that the free oxygen radicals in nitric oxide cause oxidative stress on the nervous system leading to depression. Several studies have also speculated the modulatory effect of trans-resveratrol on the HPA axis and in neurogenesis, which have been thought to be involved in age-related cognitive decline, and due to this effect may have a role in treating those with a genetic component to depression. There are currently no human trials concerning trans-resveratrol in the area of treating depression. Some have been conducted on rodents, however. Human trials have been conducted in the area of pharmacokinetics and in some cancer trials. The findings of these experiments have found that trans-resveratrol has poor bioavailability within the body, which takes it up poorly, metabolizes it extensively, and has possible problems of bioaccumulation. Some recent research has found a more efficient way of delivering the drug by solubilizing it with other compounds on rodents, with promising results received. Another possible future direction is the use of a bioavailability enhancer, such as piperine, which is found to enhance the drug bioavailability. In short, trans-resveratrol has a promising future in the treatment of depression.